Okay. Hello, everyone. I'm Nick Healy. I'm a healthcare regulatory partner in Husch Blackwell's Denver office. And I want to thank everybody for being with us today to discuss physician practice transactions. This is going to actually be really interesting, and so I'm glad everybody is with us. Before we start, I want to cover a couple of housekeeping items. At the bottom of your audience console, there are multiple application items for your use during the program today. If you have any questions during the webcast, please submit via the question box. We'll try to answer the questions during the webcast, but if a fuller answer is needed or we run out of time, it'll be answered later via email. A PDF of the presentation is available in the program materials folder. Auto-generated closed captions are available for today's program. To turn those on, click the CC button in the bottom right corner of the media player box. And a recording of the webcast will be emailed to you tomorrow for watching and sharing. Toward the end of the program, please complete our short survey. We use your feedback to plan future programs that are applicable to your business needs. And that is all for the housekeeping items. I want to, again, thank you for joining us for the first program in Husch Blackwell, our Physician Transactions series, which is a three-part webinar series on important topics related to physician practice sales. So today in our program, we're going to cover the various structures and options from a legal perspective for physician practice transactions and sales. We are also going to be hosting two more presentations on February 19th, March 5th. On February 19th, Todd Mello from Root Partners is going to be presenting on preparing your practice for a sale, 6 steps towards maximizing value and creating a smoother transaction process. And on March 5th, Brad Godomsky from Bernstein Private Wealth Management and Scott Casper from 8 Quarter Advisors is going to be speaking on succession and sale planning for practice owners. Through all three of these presentations, we're hoping to give you a well-rounded picture of physician transactions from a legal valuation and asset management and protection perspective. I do want to welcome also, joining me today is Ragini Acharya, who is also a partner in the link located in Denver with Husch Blackwell. She focuses her practice on mergers, acquisitions, and general corporate and governance matters in the healthcare industry. And as part of her practice, she assists providers, private equity sponsors, and strategic buyers in connection with transactional matters. So you've committed to spending the next hour with 2 lawyers talking about the technical aspects of physician practice acquisitions and sales. I want to give you some justification for why you've chosen to do that. And to do that, I want to tell you a story about sweat. We have a lot of practice administrators on the call today, and I want you to imagine that you are sitting at your desk tomorrow. You are answering one of dozens of emails that you get on a daily basis, perhaps hundreds, on a topic like personnel or cash flow or supply reordering. And through your door comes a senior physician partner in the practice. That partner sits down opposite you, hands you a cigar, and says, I just had my 3rd grandchild. I want to start thinking about what comes next. How can I spend more time with my grandkids? What would it look like if we started the process of preparing to sell the practice? If you've been through one of these kind of transactions before, you may think, I know what to do. If you haven't, or if you've only been through one or a couple, you may start to sweat. You may get that feeling in the pit of your stomach that we're all very familiar with. And involuntary thoughts might go through your mind. What's the first step? What do I say? How do I answer this question? You hear a bing as another email hits your inbox, and the senior partner is still sitting across from you, waiting expectantly for an answer. This presentation is intended to give you a framework for answering that question. We're going to tell you how to manage stakeholder expectations throughout the process, who to bring onto your team to guide you through it, and how to avoid pitfalls that can sink even the best planned transactions. We're going to try to help you avoid the onset of that sweat and that feeling in the pit of your stomach. And so by the end of this transaction, you're going to be able to answer the senior partner's question with, here's where we start. So with that, I want to hand it over to Ragini to jump in.
Thanks, Nick. So I think it's important when we think about why physician practice transactions matter to look at healthcare market trends. We've seen a surge in physician group mergers and acquisitions, and in particular, specialist providers and businesses that focus on value-based care have been especially attractive. We've also seen increased involvement by private equity. There was a period of reduced activity due to labor market shortages and higher interest rates. But in the last several months, especially in the back end of 2024, we've seen an increase of physician practice exits to both private equity and strategic buyers. And, part of this, I think a big part of it is, practices needing to adapt to increasing operational costs. Costs raised were by like 9% in 2024. They rose by 9%. And, this is increasing cost of medical supplies and equipment, labor costs due to staff shortages and wage inflation, investments in EHR and health information technology. And as operational costs have increased, physician practices are dealing with decreases in reimbursement rates. And taking these together, this presents challenges to the financial stability of physician practices, which then require strategic adjustments. So now thinking about transactions, they can enhance operations and patient care, but they come with complexities that require careful planning. And I want to highlight both the benefits and challenges. So benefits that come with these transactions, scalability, potential cost savings, potentially improved patient care, but there are a lot of risk. There could be cultural misalignment and additional financial instability, additional compliance concerns. There are certain regulatory pressures as well associated with transactions. There have been bipartisan efforts to address the impact of private equity on healthcare cost, on healthcare cost and quality. And a lot of states, at least 15, are introducing bills that will require notification and or approval for transactions or expand on the current notification and approval processes to include things like physician practice transactions. And so getting a handle on those is really important. In my experience, I have seen transactions work and I've seen them fail. And when they fail, they've failed, prior to getting to the finish line, and they've even failed after getting to the finish line. And usually those failures are the result of poor planning, including with respect to thinking about post-transaction issues. So by way of example, I have seen a transaction fail when I was on a buy side where a physician didn't satisfy the requirements of his consultant agreement post-closing and lost out on a lot of the purchase price that was tied up in earnout payments. And so really thinking and planning ahead is really important.
Thanks, Ragini. Planning, I couldn't agree more. Planning is a crucial part of beginning this process. And part of planning is determining what stakeholder goals and expectations are for the transaction. Stakeholder goals and expectations drive these transactions. And so knowing who the stakeholders are and what they want out of the transaction is a crucial first step. Setting realistic goals so that stakeholder expectations aren't frustrated is also crucial. These can be in a variety of different areas. In my experience, the most common areas in which goals have to be set are around price, control after the sale, timing, and one that a lot of people don't think about is legacy. I have seen a significant number of physician practice transactions in which senior partners were concerned about the legacy of the practice and whether that legacy was going to be honored after the transaction was finalized. Down to some very small things like the amount of time that individual spent talking up the name, building the goodwill that goes with the practice, and a recognition after the fact that the buyer was going to change the name through the seller into a tailspin. So those can be really a crucial, identifying those and making sure you've accommodated them can be a really crucial part of the planning process. And those require clear communication with the stakeholders. So the first step in managing expectations of stakeholders is to identify who they are. This can be simple. stakeholders in physician practices, clearly you have the owners, but then not all owners are positioned the same. You may have senior partners, you may have junior partners, you may have non-equity partners. All of these may have different expectations and goals in the transaction that you need to get them to articulate, and then you need to figure out how to honor those expectations or manage them so that they don't ultimately frustrate the transaction. Other stakeholders can include professional employees. These can be physicians. You can also have mid-level providers like nurse practitioners, PAs, nurses. All of those individuals are going to have expectations, particularly post-sale, because they're not going to have a significant part of the transaction itself. They're not going to get paid for their shares because they don't own any. Also, stakeholders include long-term staff, affiliates like hospitals, vendors, crucially patients, regulators and community organizations or granting organizations. All of these can be considered stakeholders of a physician in a physician practice who may have desires, needs that need to be accommodated or at least articulated and thought about within this planning process. So managing buyer and seller expectations can be a crucial part, and it feeds back into setting realistic goals. As I said before, each stakeholder is going to have a different set of expectations for the transaction, and clear communication with those stakeholders about their expectations is going to be really important. Unfortunately, you aren't going to be able to communicate with full transparency, or timing-wise, you're not going to be able to communicate with them all the same. Clearly, owners are going to have more transparency and are going to be brought into the process earlier than employees. And you're going to have to figure out what impact that's going to have on those stakeholders and whether they ultimately buy into the transaction. The most important question, and this is actually a question for each stakeholder, not just the owners, who gets what out of this transaction and what's the price? The easiest answers for the owners, they get usually they get the purchase price for their equity interest in the organization as provided in the governing documents. Again, not all owners are going to have the same expectations or stake in this transaction, and identifying what those stakes are going to be is critical. Vendors, though, they may have change of control provisions in their agreements with the practice that need to be accommodated. That makes them stakeholders. They have a stake in how the transaction is managed. You need to identify them. What do you offer for their consent? I have been in transactions in which that wasn't considered, and vendors, through their change of control provisions, were able to throw a wrench into the transaction at the very last minute. So those really do need to be accommodated. And going back to patients for a second, patients are clearly the lifeblood of your physician practice. How this is going to impact them, Ragini mentioned some of the benefits that come out of a physician practice acquisition or sale include improved patient care. If that's going to be one of the driving forces behind this, that should really be articulated to them at some point during the process. And the overarching goal for managing expectations of stakeholders is, how is this a win-win for all of the stakeholders? That is a crucial part of the initial planning stages that everyone needs to take into account. And as I said in the introduction, forming the right team, bringing the right people onto the boat at the very beginning of the transaction is going to make it a much smoother process. It's often the hardest initial step, but if you do it right, it can be a tremendous boon to how the organization proceeds through the process. If you've been considering a transaction for a while, you may already have a team or parts of a team assembled. If you don't, and you're at the very beginning, ask for recommendations from your existing advisors. Practices usually have attorneys they work with frequently, or bankers or consultants or valuation experts that they work with frequently. A lot of those people generally have recommendations that they can provide. They've worked on these teams before, and assembling a team that has worked together before effectively can really go a long way to making this a smooth process. One note of caution: beware the lawyer or consultant who says they can handle all aspects of this. It's possible if they are, for instance, a lawyer in a large firm, they can handle most aspects of this or all aspects of this, of the legal aspects, in conjunction with others in their firm. But beware of someone who sells themselves as the be all and end all for advice on this kind of transaction. Timing is crucial. Setting timelines and milestones as if this was a construction project, or if you're familiar with project management principles, is going to be really important. Obviously, certain aspects of transactions have to be done before others. And so making sure you've staged out the different parts of the transaction in the order in which they need to be done is important. When you're setting a timeline, treat it liberally, I guess I would say. Make sure that you understand that, notwithstanding the best laid plans of mice and men, things can go awry, and build in time, like they do in a construction project, for things to go wrong and have to be remedied. And also, going back again to the stakeholders, as soon as you can, lay out the process for them, explain it to them, and potential choke points so that they understand it and are not inadvertently frustrated by unexpected developments, and keep them updated to the extent you can. Let them know about specific points at which the project could fail, frankly. Once you have your team assembled, leveraging advisor expertise, understanding exactly what they do and what their area of authority or expertise is another crucial step. To make sure that everybody is working well together, clearly delineate the lines of authority or responsibility among the advisor team is an important part. Consider identifying a lead advisor if that's not a role you intend to take on yourself. Identifying one person who can manage, just like a general contractor or an owner's rep in a construction project, can be a really critical part. Okay. So some of the big picture items in the process, I just mentioned setting the timeline. If there are important dates that need to be accommodated, end of the fiscal year, vesting dates for stock or retirement, contract renewals, vacations, retirements, even holidays, make sure you're accommodating those. And as I said before, be flexible. Make sure that you have allotted enough time for the entire transaction to take place. It's easy to underestimate the time that all of this will take, particularly for stakeholders. They may think, this is just paperwork. How can this take this long? It's actually a lot of people. It's a lot of expectation management. It's a lot of very detailed people work. And so it can take longer than anyone would think. You could get the physician owners to think about this like a complex disease process. How long would it take to manage a complex disease process if everything goes right? What if everything doesn't go right? So getting them to think about this as a complex process with many moving parts can really go a long way to making sure their expectations aren't frustrated. In the timeline, one of the big time sucks is going to be due diligence. And Ragini is going to talk a little bit more in a minute about the elements of due diligence and why it's critical. But it's important to recognize that you shouldn't wait. You should be preparing for the due diligence process and what you're going to be expected to provide at the very beginning, making sure that you are putting in place the steps to have financial and operational transparency for a buyer, ensuring compliance programs are up and running and are being audited are going to be crucial, and making sure that governing board members of the practice understand their role in the process is going to be crucial. I want to talk for a moment here about the governing board members and their specific duties in this process. So governing board members, whether that's a board of directors or a board of managers or some other organizational structure, generally have a fiduciary duty to the other shareholders or stakeholders in the organization, the other owners, to get the greatest consideration reasonably attainable for the shareholders in the transaction. This is sometimes called the Revlon duty, from a very famous case involving Revlon. That may mean seeking valuation opinions on whether the transaction price is reasonable. That may mean getting competitive bids. And it's important to recognize this is not solely a cash consideration. There are other considerations that can be taken into account. But if you're taking into account those other considerations, make sure you can articulate why those may be worth more to people down the road than straight cash compensation for their shares in the company. Also think about hospital staff, how hospital medical staff memberships might be affected. If a significant portion of the practice's compensation or revenue in a year comes from call coverage or joint ventures with hospitals, look at the transaction documents or the organizational documents for those transactions or compensation arrangements, and make sure there's not a provision in there that would prevent you from going forward with this kind of transaction, particularly if there's a provision in there that would prevent a competing entity with the hospital from gaining an ownership stake in that practice. So think through those, what may be more technical issues before you start courting buyers. Those can be very important. Okay, and I'm going to throw it to Ragini for preparation for the transaction.
Thanks, Nick. So Nick was really talking about a lot of big picture items. I'm going to kind of get into more of the nitty gritty here. So preparation for a transaction, this is the cornerstone of any successful transactions. Buyers are going to conduct extensive due diligence. So having your house in order is really critical to ensure that not only you have smooth negotiations, but you're also maximizing your practice's value. So we start at the top. How do you identify potential buyers? Again, engaging professional advisors is a really good way to do this. Legal or financial, there are specialized brokers and investment bankers that have access to networks of potential buyers. They can proactively market the practice while ensuring confidentiality. Lawyers can also assist in screening buyers for, financial stability and strategic fit. They can also network within the industry and leverage tech and other platforms. You can also conduct your own market research and advertise discreetly. Do direct outreach to target buyers or go to industry events. What's really important here, we talk a lot about understanding your own stakeholder and your own interest, your stakeholder's interest. It's really also important to understand buyer interest and what the buyer's interests are and what their goals are. And they're going to vary depending on the type of buyer at stake. So, for example, hospitals and health systems really value patient volume, service lines, referral networks. In contrast, private equity firms will focus more on profitability, scalability, and growth potential. So in terms of initial steps, Nick mentioned this on his slide, but conducting financial and operational assessments is like first step. You want to start by reviewing your financial health. Take a look at your last 3 to 5 years of financial statements. Assess your profitability, cash flows, any outstanding debts. Buyers are going to look at profitability. They're going to look at trends in patient revenue. They are also going to look at your billing and coding practices. So that's really important to ensure that you've had accurate billing and coding practices. Issues like upcoding or incorrect billing can be a major red flag to a buyer and not only expose you to the practice to liabilities, it can also cause a buyer to walk away. Just as important as financial health is operational efficiency. So, evaluate your patient volumes, provider productivity, look at your payer mix. By way of example, I had a transaction where a payer mix leaned really heavily on a single insurer, and that ended up causing a little bit of concern for both buyer and seller during the transaction, since one of the closing conditions was getting that payer contract in place effective as of the closing date, and getting everything in order. And if that wasn't set and wasn't set up to go post-closing, that was going to have a major effect on how the transaction would work post-closing. So again, really important to get all of these things sorted out beforehand. We're going to touch on this in a couple of slides, but important to do evaluation of the practice. Legal readiness, review your contracts, start collecting them. This is going to be your leases, vendor agreements, physician employment agreements, just a whole slew of them. Because a lot of these agreements may have restrictive provisions in them, or they may be outdated, and things like that can really complicate a sale if it's not addressed up front. You also want to be looking at your agreements from a regulatory compliance perspective. Want to make sure they're compliant with Stark law, anti-kickback, and other regulations. And this all kind of circles back to just overall strategic planning. Really define clear objectives for the transaction. Think about what do you want to get out of this? Are you trying to make a full exit? Are you trying to retain partial ownership and remain involved? And if so, what aspects of control are important and what are deal breakers? Identify those deal breakers and make sure that you are culturally and operationally aligned with the potential buyers and partners that you're looking at. So, types of structures and transactions. I think it's really important to understand these different structures available and how they would impact your practice. You need to consider business needs, tax needs, regulatory considerations. So just in terms of from a lower degree of integration to a higher degree of integration, I've kind of laid these out accordingly. So you have employment agreements, which is common, for example, when a hospital system hires physicians directly. Comp models can include like salary, be production-based, hybrid of some sort. A hospital, for example, might hire physicians to build their internal referral base and standardized care delivery. Then you have management service agreements. And this is where physicians will retain clinical ownership, but they'll outsource administrative tasks. And that includes things like billing, HR, things akin to that. This is a popular model when physicians want operational support without full ownership loss. Next level up are partnerships and joint ventures. So this is where two or more entities share ownership and management. This is a focus, like there will be a focus here on shared goals or services. Partnerships and joint ventures are common in specialty services, ASCs, for example. They're also common when practices want to expand, but they need capital or operational expertise. So by way of example, an outpatient surgical group might form a joint venture with a hospital system to improve access to advanced technology. Then next level again are practice acquisitions. And these can be structured in different ways, asset acquisitions versus equity acquisitions. And I like to describe asset acquisitions as going to the grocery store and picking out the items, the distinct items that you want, or if you're the seller deciding which items you're going to sell, versus an equity acquisition where you're selling the entirety of the store. You're getting everything good, bad, ugly, expired, all of that's going with it. And so those are obviously much more integrated and involved. Buyers will often purchase assets like medical equipment, patient records, goodwill. So things to kind of consider in terms of structure. I have private equity investments on here because I think it's important to explain. This is when a private equity investment invests in or acquires a portion of a practice to scale the operations. That's usually the goal. And it often involves creating a platform to consolidate similar practices. So we call these roll-ups. I have a lot of experience in doing roll-ups, both on buy and on the sell side. We've done them with optometry practices with physicians that are looking to retire or slow down. Mobile care operations for senior living facilities, we've done a lot of those. I've also worked on, like I said, the sell side with respect to primary care groups that are looking to sell, pediatric groups that are looking to sell. They will often target practices with a lot of growth potential in order to maximize their own ROI. And while private equity can offer a significant financial upside, it does require physicians to adjust to a more corporate environment. Again, because it's a platform, everybody's kind of having to play by the same rules and the same forms. So each structure, as I've mentioned and discussed, has its own pros and cons, and the best choice really depends on what your practice goals are. So having an understanding of these structures is really important.
Can I ask a question real quick?
Absolutely.
I want to go back for a sec to the asset purchase. And I'm curious if you've seen acquirers purchase individual service lines from a practice, but leave the remainder of the practice intact.
I Yes and no. I'd actually be curious to hear your experience in this. I think because they're so special, like most of the acquisitions that we've done have been so specialized. The service line asset acquisition of it just being one service line usually doesn't make sense. Usually they're wanting the whole business because there's a lot of value to what has been built by the physician group, not just one single service line within that group.
Yeah.
So I would say that's probably a little less frequent. I mean, I have seen asset acquisitions from clinics, for instance, that are very nitpicky and they're just like three things included, and everything else gets left behind. But maybe a little less frequent with businesses that are the value is really in the whole.
Yeah, I think that's a great point. Honestly, I have not seen situations in which individual service lines are sold. I've only ever seen asset purchases as the entire set of assets that make up the practice. With big multi-specialty groups, it may be a good option, simply because I think in some situations those service lines can be carved off potentially more easily. But with big multi-specialty practices, in a lot of cases, service lines are added because they provide synergy. And so in order to carve one off, there may be synergy lost, and the practice, as you said, as a whole may not work as well. So I was just curious about that.
Yeah, no, that's a really good question. All right. So we mentioned this briefly, but about conducting valuations as a function of preparing your practice for sale. And engaging a valuation consultant and expert in particular is really important to ensure that you have an accurate and defensible estimate of your practice's worth. The valuation itself may even be a point of negotiation. Whether both parties obtain a valuation or just one of them gets the valuation, what the parameters and assumptions are of those valuations. Another big point will be what information can be shared. For instance, we had a joint venture transaction where the hospital buying in, was questioning the buy-in price. It didn't seem right, and so we asked to see the valuation. And in order to do so, we had to sign a common interest agreement because that valuation had been prepared for the other side. And so a little bit of complexity can result there. And so things to think about are, how do we even conduct the valuation? Briefly, we'll mention there's obviously different types of valuation methods. Income approach, which uses projected cash flows to estimate the practice's worth. A market-based approach, which is where you compare your practice to others that sold recently in similar markets. And then an asset-based approach, which focuses on the tangible and intangible assets like equipment and goodwill of the specific practice. Big drivers of value are going to be your patient base and your payer mix. Buyers are going to look at profit margins and your growth potential. They're also going to look at your reputation and how you are uniquely situated in the market. Nick, I kind of want to throw it to you for a second to talk about the legal perspective of valuations.
Yeah, there's two things I think I can mention here. One is very, I don't want to say technical, but it's very practical, and that's thinking through these questions, and especially how evaluation is going to be used up front, can be really important, because one of the first documents that you're going to put in place if you're going down this road is a non-disclosure agreement, an NDA. And if you create a very broad NDA and you don't think through whether you're going to do evaluation and whether that's going to be available to the other side, you may end up doing the valuation and wanting to protect it, but at the same time having already created an NDA which says you have to turn it over. So that's actually a thing to think about, a checkbox to check kind of at the beginning of the process, even before the NDA goes in place. I also want to just call back to one of the things I said with respect to the governing board and valuation, that when the governing board is determining whether they've gotten the best price they can, the most consideration for the acquisition or sale that's reasonably attainable, evaluation can go a long way to bolstering the justification for their decision to move forward. And so, although people may not want to spend the money to get a valuation, although we would almost inevitably advise people to do it, one of the ways to justify it is to basically say to the governing board, look, you're going to have this obligation to justify the price that you have agreed to sell the practice for. You have a legal duty to, fiduciary duty to your other partners to make sure that you're getting the most. Evaluation can help you do that and provide defensibility. And in fact, as we're going to talk about a little later, if there are drag-along rights in your operating agreement or bylaws, and there are unwilling people that are being dragged along, evaluation, particularly if it supports the price that you've agreed to, can really go a long way to smoothing the objections over of those unwilling people being dragged along. So I don't want to sell the valuation, but I think it really is a very important part of this process.
Thanks, Nick. So thinking about regulatory and compliance concerns, I've highlighted a few of the key statutes and regulations here. Stark Law, which prohibits self-referrals, the anti-kickback statute, which addresses payments that incentivize patient referrals, HIPAA and other data privacy and security laws, and then corporate practice of medicine laws that are state specific. That'll affect your structure potentially in a transaction. It's really important to have strategies and mechanisms in place to ensure compliance. Make sure you have policies and procedures that are addressing regulatory compliance, training programs to train your staff and employees on these policies. And then most importantly is conducting regular audits to make sure that these policies are being effectuated appropriately and trainings are actually occurring. Interestingly, while I think the conducting regular audits is actually the most important part of this, it's the one that we see happen least frequently. So really important when getting your house in order, well in advance, make sure you're conducting audits. Another thing to note is that this is actually both a backwards looking and a forward looking issue in terms of regulatory compliance. You want to make sure you have proper documentation that you're conducting audits. A buyer may back out if they discover improper billing practices. So it's important to conduct compliance audits early. They help reduce risk. They increase buyer confidence. But also, it's important to consider compliance on a forward-looking basis as well, and making sure that you're structuring your transaction in compliance with these various laws and regulations. For example, you could have an acquirer to whom seller can refer, and that could create an AKS issue, or to the extent there's the designated health services involved, could create a Stark problem. For example, we had a transaction where a joint venture entity, required an investment to be made, and the hospital that was making the investment thought the buy-in price was really high, and so we were asking the question, okay, well, what is the justification for this price? How do we make sure that it's fair market value for what's being obtained? Because if it's not, it could potentially look like the hospital, as a recipient of referrals, is making a massive payment to its joint venture partner that could send it referrals. And so from a structural perspective, it's really important and always good practice to try and structure your transaction within an AKS safe harbor or within, a Stark Law exception to the extent it's applicable. Nick, in terms of CPON and goodwill, I kind of want to let you talk a little bit about that for a sec.
Yeah, CPOM, corporate practice of medicine laws, I'm actually going to address in a couple of slides. So I want to just go to goodwill real quick. And this is actually almost certainly going to be covered by Todd Mello in his presentation, the next presentation, because there's a fantastic article called "What is Goodwill" on the Root Partners website that I would, Root Valuation website that I would encourage everybody to take a look at. I just want to flag here that goodwill can be a difficult topic to address in a transaction like this. There are compliance concerns with certain acquirers like hospitals paying for goodwill. There's long-standing OIG guidance that casts doubt on particularly hospitals' ability to buy a physician practice and accord any element of the purchase price to goodwill, which has been modified a little bit in more recent years. But it seems like every physician practice I work with, there is someone who has spoken with a colleague who, in a different practice, whose practice was purchased by someone and they were able to be paid a ton of money for goodwill. And so addressing this early and whether this can be an element of the purchase price is going to be important, as well as determining whether, when you say goodwill, are you talking about just reputation? Are you talking about other species of intellectual property like registered trademarks or trade names, copyrights, those kind of things? Or are you talking about medical records? Sometimes those are lumped into goodwill. All of those can be very important to flesh out up front to make sure that if people have expectations about being paid for goodwill, that they're being clear about what's going to be permissible and what's not. And it can even go to the buyer. As I said, hospitals have different restrictions on paying for goodwill potentially than private equity. So all of these goodwill is a complex topic in and of itself. And I'm interested and really looking forward to what Todd Mello from Root Valuation has to say about that.
I do want to just acknowledge that we see there's a few questions have come in. Nick is going to touch on drag along rights in just a couple of slides. And Nick, one of the other questions we've gotten, are there particular valuation companies that are more in tune with medical practice value, volume, patient base, and payer mix? I do believe that is the case. We work with a lot of different valuation companies, and depending on the practice's specific needs or the provider's specific needs, we can give a good recommendation for a valuation firm or company that can do that kind of work. I'll jump to the next slide if that works for you.
Yeah, would one of those be one of those recommendations be Root Valuation?
Root Partners, yeah, I think so. So we'll put a plug in for that. Okay, so we are burning through our time, so I'll keep going. So we've talked a lot about, preparing and big picture. And now we want to talk a little bit about what the negotiation points are going to be for a transaction. So purchase price, that's going to be the result of, buyer and seller hopefully agreeing to what is a fair valuation. We'll also address your payment terms that could include earnouts or contingency payments. These are things that buyer may propose in order to align their incentives with performance of the seller post-closing. One thing to note, while earnouts are extremely common in non-healthcare transactions, they are less common in healthcare transactions, a little bit more so in recent years, but they are still an AKS risk, particularly if they're associated with referrals or they are seen as such. So always important to really carefully structure and scrutinize your earnouts. And I'm going to jump down to liability assumption really quick and risk allocation. This is, what will be assumed by buyer, what will remain with seller. Your reps and warranties are going to provide assurances about your practice's financial and legal standing. Your indemnification clauses will define the liabilities and allocate the risk between the two parties, including addressing any monetary limits associated with that risk assumption. To briefly mention, there's also the concept of rep and warranty insurance. And this is insurance that covers breaches of reps and warranties that may be made by the seller to the buyer. And while rep and warranty insurance really started in the 90s, it really didn't get in vogue with healthcare deals until the 2010s, really 2017. It's common, more modern trend is with bigger transactions, but I'm going to leave it for another topic. Sorry, I'm going to leave people unsatisfied if they want to know more about rep and warranty insurance, but that could be an entire 60-minute presentation on its own. But to go back up, I want to talk about employment agreements and non-competes. So in addition to the stakeholders that are actually negotiating the transaction itself, you're looking at and negotiating your own employment agreements and the terms therein, roles, responsibilities, comp, duration, et cetera. You also need to be thinking about those physicians who may be coming along with you as part of the transaction and who aren't active in the negotiation process. So if your transaction closing is contingent upon getting XYZ physicians to sign employment agreements with the buyer, you really want to make sure you're thinking about, as you're negotiating their agreements, what their expectations might be. And this is, like Nick had mentioned, this is a good example of identifying your stakeholders that may have different expectations, and why this is an important preliminary step. because you don't want to get to near closing and then be stunted or stopped because you have a rogue physician who's like, I will not sign that employment agreement form. Another part of employment agreements and the definitive documents are non-competes. I want to call out that there's two different types. They're the business non-competes, which is what restricts individuals from selling the business, that are selling the business from engaging in competitive activities after the transaction. And, to the extent you can sell the goodwill as part of the deal. These are generally enforceable. And in contrast, there are professional non-competes, which are applicable to individuals. And this is what most physicians are familiar with. They prohibit the practice of medicine or whatever profession within a specific location or time, or for a competing entity. They're used to protect patient relationships and confidential information. In contrast to business non-competes, which are generally enforceable, professional non-competes have been banned or restricted significantly in many states, California by way of example, Colorado. So again, these are state specific. So you need to look at wherever state you're in to decide what you can and can't do and what you can and can't agree to. Two things that are not on the slide that I'll mention: overarching structure. Again, whether or not something is going to be an asset deal versus an equity deal. The decision about whether or not how you structure the transaction will have tax and legal implications. So important to consider as a negotiation point. And then finally, and probably most noticeably, is your role post-transaction. Are you transitioning to an employment or consultant role? You'll really want to know post-transaction, what the scope of that role is, what the expectations are, for how long. And Nick has some points about best practices that I'll let him speak on briefly.
Yeah, in the interest of time, I just want to hit the last one: flexibility and concessions. In any negotiation, anyone who's realistic about negotiation, that there are going to be concessions. You are going to make concessions to the other side in order to get a deal done. Planning, and especially managing stakeholder expectations, is important in this respect. There could be senior partners again, or junior partners, or other owners or stakeholders that have very firm expectations about, I have contributed my entire career to this practice and it is worth this, or, I'm going to have this much control over the practice after we sell it, or it's going to be known by this name even after we sell it. Making sure they understand where the most likely areas for concession are, even before you start talking to the other side, are going to be really important. Because if you've prepared them for the possibility of having to concede on certain things, then, and identified their most important goals, then I think it can make a much smoother process, and it can minimize the choke points and places where a transaction could get hung up immeasurably. So that's really what I wanted to say about that.
All right, so I'm going to just briefly touch on this because I know I think we should get to the mitigating risk slide after this. But one point I'll make about transaction documents, there's several documents that are essential to formalizing and formalizing the sale. A frequent question we get is, well, who should be tasked with drafting these documents? And really, while it can be more expensive to be the one who does the drafting, I personally think that it does give you the first bite at the apple. It can help you as the physician practice set the parameters for what you are negotiating, from where you're negotiating. So what reps and warranties that you can make about your practice. Whether or not you have BAAs in place with all the people you're supposed to have BAAs with. And if you are the one doing the initial draft, you're able to kind of not limit necessarily, but circumscribe the scope of the reps and warranties that you're making. And depending on how much the other side wants to push back or negotiate, they'll have to do that on the second half of it. So briefly, there's the LOI, which outlines the preliminary terms and conditions. It'll touch on all the major key terms of the deal, including timing and exclusivity. Nick already mentioned confidentiality agreements. This will protect sensitive information and outline permitted disclosures. And then there's the definitive documents. When we were talking about definitive agreements, we're talking about, for an MSA, for a management agreement deal, a purchase agreement, or an affiliation agreement or joint venture agreement. Those are all the things that are going to effectuate the deal. They'll be where your reps and warranties and your covenants sit. It'll include the indemnification we discussed. It'll have your conditions in order to close, and it'll include any other extraneous or like extra necessary schedules or exhibits, including ancillary documents. I will turn it over to Nick now because I think this is going to be a really cool, important slide.
Way to set expectations. We're talking about managing expectations here, Rodney. Okay, mitigating risks. Again, we're kind of nearing the end of our time, and so I want to just touch on a couple of important points here. And I want to address one of the questions that came in about clarifying or further expanding on drag-along rights. So identifying pitfalls, again, this is part of the initial planning process. And we have talked about, people's goals and the need to prepare people to be flexible and identifying compromise points. So it is important. This just highlights the importance of careful and thorough initial planning, because the best way to mitigate risks is to anticipate them and identify them before they materialize. Contingency planning, that's if the transaction falls apart, do you have a contingency? Do you have the ability to keep going as a practice? Do you have another buyer lined up? Those kind of things can really inform the stakeholders' goals and ensuring that people have realistic expectations. If there's a contingency plan in place or a backup, you can take potentially a more hard negotiating line in the process. And so, identifying the pitfalls up front, planning for contingencies if the process either comes to a screeching halt or takes a very strange turn, those can be really crucial. Legal and regulatory issues. The one part I do want to talk about here, well, the two parts I really want to talk about are the drag-along and CPOM issues. So first on drag-along rights, it's important to look at your governing documents and determine whether there are drag-along rights provided for in those. And that's usually in bylaws or an operating agreement. So what are drag-along rights? They're generally a clause in the agreement, which the governing documents, which give a majority or a certain threshold of owners the ability to essentially sell the practice and drag along or require the other owners to sell their shares in the practice or ownership interest to a buyer if that threshold is reached. So potentially if 75% of shareholders agree to sell their interest to a third party, I've seen clauses where the remaining 25% are deemed to have agreed to sell on the same terms and conditions. They are drug along. And these can be buried in documents. I was involved in a transaction one time where there was a lot of internal negotiation about whether to accept an offer from a third party or not. And it was very hard fought until someone took a very close look at the operating agreement for the LLC and realized that, the majority who was in favor of the sale had drag-along rights. They had the ability to drag the minority along with them. And once the minority realized that, the negotiations took on a much different tenor. And so knowing what that threshold is, which stakeholders are likely to go along with those, that can be a really important thing for determining what stakeholder goals are. So definitely look at your governing documents, determine whether you have drag-along rights or tag-along rights, which are essentially the opposite, the ability of a minority to take advantage of a deal that has been negotiated and agreed to by a majority. CPOM issues or CPOM issues, as Ravani likes to call it, and I don't know why I have a visceral reaction to calling it CPOM, but my point here is that particularly with respect to private equity or acquirers who operate nationwide may have come up with a model for acquisitions that they really like that is intended to satisfy certain jurisdictions' corporate practice of medicine regime. And they may bring that structure to you in your state, and it may be very complicated or onerous, and it isn't necessary to satisfy your state's corporate practice of medicine regime. And so the point here is really take some time and understand what the CPOM regime is in your state, so that if a buyer comes to you and says, this is the structure we want, it seems onerous to you, you can push back and say, look, that's just not necessary. We don't need to do it that way. We can do it this other way. Last point, this goes back to communication. But in a lot of situations, the buyer is paying for, in some part, workforce in place. They're paying for the going concern value of the business. And there may be requirements in the purchase agreement that the purchase price is paid out over time after closing, and it actually decreases depending on the number of key employees that stay with the practice after the fact. So again, going back to stakeholders, those can be important stakeholders, managing their expectations, determining how you're going to communicate the practice purchase or acquisition to them can be really critical. It can really have a big impact on the purchase price. So down to the last two slides. Ragini, I would actually suggest that we go to the last one.
Okay, sure.
Okay. So I'm going to let you talk about due diligence and strategic alignment.
Yeah, so I mean, this has all kind of been said previously, but really we have to harp again and again. Due diligence and getting your house in order is extremely important. You want to make sure that you understand where you are, so you can strategically align with potential buyers. Again, we'll emphasize the importance of getting professional guidance and good professional guidance throughout the process, not just at certain portions of it. Because this is all really important in order to plan for long-term success. You want to be able to start planning early and focus on aligning your goals with potential buyers. So and that even includes, thinking about planning your exits during the strategic alignment process, because, you think you found a great buyer, you think you found a really good situation, you're excited for closing and the next step, but you also need to be thinking about, okay, well, what if things go south a couple of years later? Do you have an exit strategy from the transaction that you've completed? A really helpful tool as well is to work backwards. And so that way, how early you need to start getting your house in order. I mean, it's always nice to have a clean house to start and have everything done properly and appropriately. But, if you want to sell in potentially 2 years from now, start thinking about when that means you need to get your financial statements together, start taking stock of your operational efficiencies, all of those things. So work backwards, and that'll help you figure out when you need to get started.
And to emphasize and kind of have the last word on that, if your house is in order, then you have the ability to be nimble and you can take advantage of changing market conditions. One of the yardsticks in a lot of situations for purchase prices is EBITDA. And basically you're selling your practice on a multiple of EBITDA. Those go up and down. And so if your house is in order and the multiple of EBITDA suddenly goes up, then you can take advantage of that much more easily than if you are trying to a rearguard action and trying to get your house in order to take advantage of a momentary fluctuation in the market. So I can't put enough emphasis on getting your house in order now to be able to be nimble and take advantage of those opportunities as they come along. Okay, I think that is all we wanted to say about that. So just to finish off the presentation, I really want to thank everybody for joining us today. We hope it was helpful to you and your organization. As a reminder, a recording of the webcast will be emailed to you tomorrow for watching and sharing. Again, please fill out our brief survey. We do use your feedback to plan these future programs. And again, a plug. Please be sure to tune into our next program in the series, February 19th, Preparing Your Practice for Sale, 6 Steps Towards Maximizing Value and Creating a Smoother Transaction Process.
I will.
Go ahead.
Oh, I was just going to say, I also want to make sure, to the extent you have questions and you have to run right now, please feel free to email me or Nick. separately. We're happy to chat outside of the webinar room, the virtual reality. So happy to do that.
Yeah. And again, last point, want to thank everybody for tuning in. I want to thank my co-presenter Ragini for doing a great job. And I hope everybody has a fantastic rest of your day. That concludes the presentation.
Thank you all.